I'm Anne Rancourt, reporting for HIV.gov here in Boston at the Conference on Retroviruses and Opportunistic Infections. And I'm joined today by Dr. Don Smith from the U.S. Centers for Disease Control and Prevention. Thank you so much for joining me, Don.
Thanks for inviting me.
And so, Don, you presented today on compelling new evidence about who needs PrEP and who is getting PrEP here in the United States. And so before we get started talking about your analysis and the results, what is PrEP? What should folks at home know about this drug?
Okay, PrEP is a medication. It comes in a pill, and you can take that pill every day. And if you do that and you're exposed to HIV, it will keep you from getting HIV infection. Great.
And so tell us a little bit about your analysis. What did you find in terms of who needs PrEP in the United States?
So we wanted to understand the number of people in the U.S. who have behaviors that may cause them to be exposed to HIV and therefore would benefit from taking a pill to prevent them getting HIV. And we had previously looked at this number for the nation as a whole, but we wanted to try to understand how that varied state by state across the United States. So we figured out a new method to do that, and our method showed that there were about 1.1 million Americans who could benefit from the use of PrEP. And then we took the next step to say, well, of those 1.1 million, how many of them are at risk because they're men who have sex with men? How many of them are at risk because they're men and women who have sex with opposite sex partners? How many of them are at risk because they may be injecting drugs? And so we were able to look at the numbers by what we call transmission risk group. But then we took it yet a further step, and we said, we know that rates of HIV infection differ by race, ethnicity, as well as transmission risk group. And so can we figure out what number of each of those groups is Black and Hispanic and Asian and white? And we were able to do that. So this is the first time that we've presented the data in those different subpopulations as opposed to just the total number.
And of the 1.1 million Americans who are indicated for PrEP that you mentioned, how many are actually getting PrEP?
Well, in the nation as a whole, far fewer than we need. There are something just under, somewhere between 70 and 100,000 patients, depending on the year that you look at the data, that are taking PrEP. Out of the 1.1 million. So less than 10% of the people who need it are currently using it.
And when you did the breakdown by race and ethnicity, what did you find there?
Well, that was actually more startling to us. What we found was that of the 1.1 million, almost half of them are African American men and women. And as you may know, African Americans are about 14% of the U.S. population. So it was very sobering to see that the proportion of the population that needs PrEP is so heavily weighted towards African Americans and Hispanics. African Americans and Hispanics together were 2/3 of the people who would stand to benefit from PrEP.
So such a difference between those who need PrEP and those who are getting PrEP. What are some of the barriers that exist that cause this gap?
We know from other studies that there's a process by which any new treatment gets implemented over time. And there are factors that affect the patients who would be using an intervention and also the providers. And both of those things are going on in PrEP. So for people who would stand to benefit from PrEP, we know that not enough of them even know such a thing exists. So, you know, I know that birth control exists, and I go to my doctor and I say, I think I need the pill. And we have a conversation. If patients don't know that there's a pill that prevents HIV, then they're not going to ask their doctors about it. The second thing is that doctors are slowly learning that there is such a thing as PrEP. And so they're not going to offer it if they don't know about it. As we've made progress in sort of getting the news out to providers, though, there are other issues that have to do with because it's a medication and because you need to come in for medical visits and certain kinds of laboratory tests, then you need to have insurance. And so there's been a process of making sure that we have a way to get insurance to the people who are interested in PrEP and who would benefit from PrEP. For the providers, it means that they need to ask questions that sometimes make them uncomfortable about people's sexual behavior. And so we've been trying to find ways to make it easier for providers to ask those questions in a quick and simple way, so that they can identify which of their patients they really should be talking to about PrEP.
Mm-hmm. And so for people watching our Facebook Live today, if they're a medical provider, what are a couple of things that they should be doing moving forward? And if they're an average person who thinks that PrEP might be right for them, what should they know to do?
Well, for providers, CDC is about to produce a toolkit which will help providers, and we already on our website have materials that providers can use. So, for example, we have a wall poster that you can put up that says, what if there was a pill to prevent HIV? There is. Ask your doctor. We have brief screening tools to help them identify patients who they might want to talk to about PrEP. And similarly for patients, we have information on our website about what kinds of insurance you might be able to get and where you would go to get information about those kinds of insurance. I think the other thing that CDC and other branches of the federal government are doing, however, is integrating PrEP into all of their provider education efforts, so that more providers know about it. And introducing PrEP into all the activities we fund with community organizations and with health departments, again, to make sure that everybody knows what it is, how it's used, and how to access it.
Wonderful. And this is very exciting data. Thank you for joining me today to talk about it and share it with folks watching online. And we do have some folks who are watching online who chimed in to let us know they're watching from Chicago, DC, and Orlando. Great to have you guys with us. Thank you. For more information, please visit hiv.gov, and we'll be back this afternoon with more from CROI. Thank you.
You're welcome.